My name is Paul Fontanez. I'll be teaching you today on delegation of patient care. At the end of this presentation, you'll be able to identify the terms delegation, accountability, responsibility, authority, and competence, and relate to the 5 rights of delegation, and identify potential obstacles to delegation. First point, delegation. What is it? It's transferring the responsibility for the performance of a task from one individual to another, but while still maintaining an accountability for the outcome. And the accountability is the person who's responsible. The nurse is responsible and answerable for any actions or inactions by themselves or that they delegated to others. Responsibility involves the person providing the patient care. Are they performing at the acceptable level which they've been educated for? And then responsibility, the nurse can transfer responsibility and authority for a delegated task, but they still retain the accountability for delegating the process. Authority occurs when a person has been given the right to delegate, which nurses have that right. They've been given the authority defined by the State Nurse Practice Act, and they have the right to delegate duties and give directions to unlicensed assistive personnel. Competence, it's just referring to, the person that you delegate it to. Have they maintained their competencies in their job and in their role? They're required to practice safely and ethically in their role. Some factors to consider prior to before delegating: is there any potential for harm? Is the task complex? Is there any problem solving related to what's going on? If there's unpredictability of the outcome or level of patient interaction, then you might consider not delegating that task. As a new grad, you're going to be responsible to know, are there any applicable state or federal laws? If you leave the state of Connecticut, what are those roles in the new state for responsibility of the nurse? Any agency policies wherever you're going to be working or what the clinical situation involves, and then any professional standards of nursing. The registered nurse is directly responsible and accountable for nursing care. They're analyzing the data, they're doing the assessments, they're forming the diagnosis, they're planning, implementing, and evaluating the whole nursing process. Assistive personnel will help with activities of daily living, such as bathing and feeding and toileting or ambulating. These can be assigned. The responsibilities can be assigned, but it's really the assessment and the evaluation that cannot be assigned. The 5 rights of delegation: making sure it's the right task that's being delegated, it's the right circumstance under which you should delegate, that you're delegating to the right person that has the experience, that there's the right direction and communication, that we're clearly communicating to that person who's delegating, that we're delegating responsibility to, and that we're giving them the right supervision. Some obstacles are, reasons why nurses may struggle with delegating is that they may fear being disliked. They may fear a loss of control, or who should they delegate the task to? Or maybe they don't have good communication skills. They may feel lack of confidence. This challenge may happen for someone who works on the floor. If you worked as an assisted personnel, and then all of a sudden now you're becoming a nurse, you have to develop and get over some of these obstacles where you're delegating now to people who were once your peers. Inability to prioritize, lack of knowledge, or if thinking that my way is the only way and the right way. The RN will delegate those tasks for the task for which he or she believes staff have knowledge and skills to perform. Got to make sure the communication is clear, concise, and complete. And you got to make sure you verify comprehension with the staff member. Some of the risks: you can end up overworking some personnel and underworking others. You can place a patient at risk, or personnel may feel uncomfortable performing duties that they may not be familiar with. Patient assessment, triage, nursing diagnosis. You're going to delegate. What we usually delegate from the nursing process is those things that fall under implementation phase of the nursing process. The rest, the assessment and evaluation, all will remain with the nurse. Here's a question to throw at you. just to see how you do. A new graduate nurse asks the charge nurse, how do I know what I can or cannot delegate? What is the best response? A, delegating time and practice to learn what you can or cannot do. B, if you follow the 5 rights of delegation, you should be fine. C, every state has standards, laws, and guidelines for delegation to guide you. Or D, you will not be delegating, only the charge nurse delegates, so there's nothing wrong, nothing to worry about. So here the correct answer would be C. Every state has standards and laws to guide you. State boards of nursing, many states specify nursing tasks that may be delegated in rules and regulations, and they may vary from state to state. So you want to review the Nursing Practice Act of your individual state. Here's another question. Nurses starting a shift at 11 p.m. What should be delegated to the UAP initially? Assess the pedal pulse of a patient who arrived on the floor at 5 p.m. New post-op femoral popliteal graft placement, or passing fresh water to all patients, taking vital signs on the signs patients prior to midnight, turning off the IV pump alarm that is beeping. So the first one, A, it can't be because it's involving assessment. B is not a priority at the time because it's passing fresh water, where the vital signs are what you'd like to be checked before you start giving your medication. So that can be delegated. And here's just a YouTube video that I'd like us to watch regarding delegation.
Hey, excuse me. Okay, yeah. You know what? We're really going to have a really busy morning today. I need you to do vital signs in room 55 first. And his blood pressure was a bit unstable last night based on report. As you can probably tell from the smell, he has also soiled himself earlier this morning, so he needs a diaper change as soon as possible. Take care of room 55 first before you do all your vital signs, okay?
Okay, well, I have a busy schedule too, you know.
I have a busy schedule too. And by the way, in room 55, he's really hairy, so I really need you to put copious amounts of the CHD wipes too. And also, please be sure to chart your vital signs immediately after you take them. Yesterday, you missed...
yesterday wasn't my fault. I was on break at noon, so whoever did it wrong. That wasn't me.
Well, I just want to let you know you need to be very careful. You need to be even more careful, okay? So 12 o'clock vitals yesterday was missed in room 46.
Wasn't me.
Okay, whatever. You know what? I could be wrong. I don't have time to argue or to get defensive. So for room 55, are you clear about what you need to do?
Yeah. You know what? He's actually a little bit big. Do you think you can help me out?
You know what? We've had him before, and I looked at him really briefly.
So you know how big he is?
He is a min-assist, and he has good bed mobility. I don't think you're going to have any trouble, changing his diaper. I'm sure you can handle it very well on your own, and I would be very surprised if you call me for asking for help. Maybe you can ask your other colleagues to help you. As, like you said, you have a full assignment, I have a full assignment too.
Yeah, I have like 10 patients that I have to do vitals on today too.
Okay, well, you know what, if you have any urgent needs, or if anything important comes up, just call my cell phone.
I can't talk, I have tumor stuff too. So.
Okay.
So here in this video, this is poor communication. As you can see, the two people were not even eye to eye. They were kind of just talking and getting defensive with one another. Some tips that can help us be clear on qualifications of what you're delegating. Most important, especially with the video, speak as you would like to be spoken to. Communicate effectively. Talk to them, look at them face to face. You're a team, work together. Identify any expected outcomes, and then verify that whatever you delegated, that they understood the task that you're delegating, and then monitor it. Accept some minor variations. They may not do it exactly the way you would have done it, but it's okay as long as the job was done. There might be some minor variations, and then meet staff's needs with learning opportunities. They may if someone doesn't know how to do something, be there to guide them. In the previous video, if they would have just worked together and communicated and said, hey, you know what, this is a heavy patient, why don't we turn them together? That's what you want to do as far as delegation. You don't want to have that poor communication in the video that we just saw. And these are my references. Any questions?